Hi, my name is Kathy, and I'm a member of the speech pathology team here at Jamaica Hospital. Most people are aware that a person who suffers a stroke may have paralysis or weakness on one side of the body. Some may not realize that a stroke can also cause difficulty in communication, cognition, and swallowing. Today, we'll discuss difficulty in swallowing, which is called dysphagia, and is common after a stroke. Dysphagia is defined as difficulty safely moving food or liquid from the mouth to the stomach. When a stroke patient has dysphagia, it can cause serious health problems and interfere with quality of life. A person with dysphagia may not be able to eat regular food or drink regular liquid. They may require modifications in diet, like chopped or pureed food, and may need their liquids to be thickened. Due to difficulty in swallowing, some of these patients may not be able to eat and drink enough to meet their nutrition and hydration needs. A very serious complication for a stroke patient with dysphagia is known as aspiration. Aspiration occurs when food or liquid go down the wrong way, entering the airway, which leads to the lungs. This can result in a very serious type of pneumonia called aspiration pneumonia. For a stroke patient with dysphagia, food and liquid may enter the airway on a regular basis. It is vitally important for a person who has suffered a stroke to be evaluated for dysphagia. The speech pathologist does several types of evaluation, which include bedside swallow evaluations, modified barium swallow, and fiber optic endoscopic evaluation of swallow. Based on these evaluations, we can determine the safest diet liquid consistency, or when the risk is extremely high, recommend temporary non-oral feeding by tube feeding. During the objective swallow study, the speech pathologist can try all different types of compensatory strategies to help improve the swallow. These may include the chin tuck or a head turn. Once swallowing has been evaluated and risk of aspiration is minimized as much as possible, the speech therapist can begin therapy to help the person restore a more normal swallow function. Depending on the impairment, exercises can be specifically targeted to improve muscle strength and range of motion of the structures involved in swallowing. Swallowing is reassessed on a regular basis in the hope that patients on modified diets can return to a more normal diet, or that patients who are on tube feeding may return to some form of eating by mouth. In summary, a stroke can cause significant difficulty in a patient's ability to swallow normally and safely. Early identification and intervention for dysphagia is crucial to help prevent the many complications that can occur from aspiration. It is very important that any stroke patient with dysphagia follow the recommendations of their doctor and their speech pathologist, that they adhere to the recommended diet and liquid textures, and participate in dysphagia therapy to help restore normal swallowing function. Thank you.